Good day, everybody. Today, I'll be giving to you the report or the term paper that I made as a partial fulfillment for public health class that I'm taking right now. But first and foremost, I would like to extend my thanks and gratitude to Dr. Raman, our professor in this class. Indeed, it has been a wonderful experience to be in this class, and it was likewise a great opportunity for me to bring myself to a higher level because of the new principles and learnings that I have learned in this class and in public health organization at large. So let's begin with our presentation. The topic that I chose to discuss or to write is health screening among adult Filipino-Americans in Fresno, California with type 1 and type 2 diabetes and hypertensive disorder to reduce the risk of developing chronic and end-stage renal disease. And as we all know, diabetes and hypertension is very much prevalent, and you will realize later on that Filipino Americans are likewise one of the population who are at risk of developing end-stage chronic disease or end-stage renal disease. And my name is Dennis Redubla, and I am a part of this class, and I'm the presenter or proponent of this term paper. So let's continue. This afternoon, we will be discussing the following. We will deal with diabetes, hypertension, and its relationship to end-stage renal disease. We will also deal with the existing literature about diabetes and hypertension among Filipino ethnicities. And we will go to the convening the community and how we will be creating a shared vision for this type of health project. We will have an assessment of current realities and trends. We will go in detail on the plan of action. Then we will discuss the doing the job and monitoring, and finally the outcomes and conclusion. So we go first with the relationship between the diabetes, hypertension, and kidney disease. Diabetic diseases or diabetes mellitus are very common nowadays. Many, if not almost all of us, have close relatives with diabetes. This means that diabetes has a high blood sugar level that tends to damage the tiny glomeruli. Glomeruli is one of the basic parts of our kidneys. Thus, a common complication of diabetes is a chronic kidney disease. Hypertension is also common nowadays. Hypertension is a comorbid disorder among diabetics. This means that this occurs simultaneously with patients who are having diabetes mellitus. Hypertension in diabetes actually accelerates the damage done to the kidneys. That eventually results to kidney failure. Kidney failure is the final stage of chronic kidney disease. 44% of kidney failure cases are caused by diabetes mellitus. This is deadly and costly, as we all know, and the only solution for this is a successful kidney transplant, but not without complications. We continue with our slides, and at this point, we'll be discussing the existing literature about the diabetes and hypertension, especially among Filipino ethnicities. Several studies actually show that Filipinos and Phil-Ams are more predisposed to diabetes than Caucasians and Black Americans or African American. This applies on Filipinos in the Philippines as well as in the United States. Based on our statistics, 50% of diabetics remain undiagnosed. Kidney problems, for your information, does not have specific symptoms, and it does not appear until large numbers of glomeruli are affected, which means we can only detect that on its advanced form or advanced stages. Literature also says that community efforts can help reduce the impact of diabetes and hypertension. That's why we are geared towards this health project so that we can mitigate or reduce the potential advent or the potential complications of diabetes and hypertension. Health education, partnership with healthcare facilities, health advocacy, and culture-friendly services can absolutely make a difference. And community-wide services can help reduce the risk of hypertension and cardiovascular diseases. This may include health education, screenings, case management services, lifestyle management classes, and these are deemed to be effective ways to control blood sugar, cholesterol, and blood pressure levels to more manageable levels. We go to the next, and this is convening the community. How to meet the community together. It will show the prevalence and risk of diabetes and hypertension in the community through health screenings, and this is what we intend to do. We will teach them their options for availing medical help and support for diabetes and hypertension, with focus on newly arrived immigrants, illegal immigrants, and the elderly and those without health insurance. Educate them about the serious long-term risk of diabetes and hypertension like chronic kidney disease. We educate them about preventive strategies and self-care methods to help reduce risk or prevent complications. To convene the community, we need to do the following. Identify the core team, the leadership structure, and geographical target. A core team will be formed with clear leadership structure. The target, of course, will be Fresno, California. We will be identifying the leaders in the community and eventually gain their support. Church leaders will be reached out in particular because Filipino-Americans are often affiliated with local churches. Then we will identify the cost as well as its potential benefits. And this will be determined during stakeholders meetings. How do we advertise or how do we spread the message? We will use different forms of media like internet, radio, and print that might include newspapers such as Fresno Bee and local magazines. Public announcements and posts in churches. Word of mouth. Announcements during public meetings. Posters and posts on public places. All kinds of media will be used. The message will be made compelling and inviting to qualified recipients or patients. Let's go to the creating a shared vision. In the general meeting with all the leaders or stakeholders, we will discuss the following: the risk of diabetes and hypertension, and our solution, which is health screening and preventive education. Define the scope of the vision, and that is to be able to identify the segment of the population with diabetes and hypertension and prevent them from developing end-stage renal disease. We will also discuss the importance of increasing awareness and preventive measures to prevent or mitigate diabetes and hypertension and the development of chronic kidney disease. Follow-ups for sure will be made as necessary. In sharing our vision, our goal is to reduce the incidence of diabetes and hypertension among Filipino-American community in Fresno, California. We go to the next part of the paper, and this is the assessment of the current realities and trends. Questionnaires will play a vital role and will be used to quickly retrieve information, especially those who are at risk or those who have diabetes and hypertension. Continuous research and interviews will be done to determine current realities and trends. We will likewise make continuous assessments in different locations such as hospitals, health centers, church venues, and public places. All information from the assessments will be compiled in a report. For the action planning, remember, our plan of action is to identify high-risk individuals among the Filipino-American community and to implement preventive measures to prevent them from having diabetes and known diabetic and hypertensive individuals and newly identified cases. And will be educated on preventive measures to prevent onset of complications like chronic kidney disease. Project framework. We'll be identifying patients aged 40 to 60 years of age who are at risk of diabetes and hypertension. We'll identify patients, we'll give them health teachings and give proper resources to reduce risk of diabetes and hypertension. We'll teach patients about diabetes and hypertension and its consequences and how to live a healthy lifestyle, and we will mobilize community effort to reduce impact of diabetes and hypertension. We go to the designing and writing the action plan. The core team and leaders of the stakeholders will meet and deliberate the action plan. Their opinions, views, and recommendations will help formulate an effective plan that is realistic as possible. On the revision, distribution, and support to the action plan, a regular meeting will be held to revise the action plan as deemed necessary. All leaders of stakeholders are made to sign a document called the Charter as an act of affirming their endorsement to the program. Let's go to the next. Doing the job, monitoring, and adjusting. First, we need to capitalize on strengths. Our, our strengths include the following. Close-knit community characterized among Filipino-Americans. Fewer language barrier problems since most Filipinos understood and can speak basic English. Large numbers of Filipino-Americans, health workers like nurses, and physical therapists. Number two, we need to find more partners. Potential partners that we can include in this project, Filipino-American associations, and there's a lot of them, in Fresno, California. Retired Air Forces personnel, charity groups, healthcare groups, diabetes, hypertension, and kidney disease advocacy groups. Number three, get buy-in and secure commitment of partners. We can do this by making a project charter, meeting with the leaders of partner groups and explaining our vision, giving recognitions like certificates and trophies to partner organizations. Number four, get and maintain resources. We will get support from the following: local government units or county units, volunteer and non-profit organizations, philanthropists. Number five, get the word out. We will spread the news using the following media outlets: radio, television, internet advertising, and social media like Facebook and Twitter, print media like newspapers and magazines, word of mouth. Number six, undertake the projects and initiatives. Here are some community-wide methods that will be undertaken. Perform interviewing, information gathering using questionnaires and diet recall assessments, and health teachings to the participants as well as mobilizing community effort. Declare no meat and oil days 2 times a week. Declare no sweet drinks and salty foods days 2 times a week. Declare no alcohol holidays 2 times a week. Number seven, deliver the goods. We will deliver through counseling and health teachings to prevent development of hypertension and diabetes. We will be performing blood sugar checking, basal metabolic index assessment, and blood sugar monitoring and blood pressure exams to determine who is at risk for diabetes and hypertension and its related complications. Number eight, sustain the project and needs of the people. We will do this by ensuring continuous and uninterrupted supply of manpower, funds, and supplies and materials to the program. Refer complicated cases to appropriate medical facilities. Ensure that vulnerable groups like newly arrived immigrants and undocumented immigrants and the elderly are given proper care and referred to advocacy groups. Number nine, stay focused and fine-tune as needed. We will do this by performing regular audits to keep expenses in check and ensure that funds are spent properly. Perform regular assessment reports to determine the needs of the people and possible solutions. Expected outcomes will be as follows. People know whether if they are pre-diabetic or have diabetes. People will have enough understanding about diabetes and hypertension. People know measures on how to reduce the risk of having diabetes and hypertension. People with diabetes will be educated on how to best manage their condition and live a lifestyle that will reduce risk of complications. Filipino-Americans who are recent migrants, those who don't have health insurance or social benefits, or in advanced age now have better access to health programs meant to reduce the risk of diabetes and hypertension, and those who have the said conditions have access to appropriate health care facilities. The Filipino-American community in Fresno will work together to address diabetes and hypertension. Finally, the conclusion. Studies clearly show that Filipino ethnicities like Filipino-Americans are prone to diabetes and hypertension. These two conditions can greatly put the patient at risk for untreatable chronic kidney disease. Kidney disease at its worst stages is costly to treat with no chance of good prognosis unless kidney transplant is performed, but not without complications. Therefore, to avoid worst case scenario from happening, preventive measures must be implemented as early as possible. We can help make the Filipino community aware of this health problem by exploiting exclusive attributes like the close-knit nature characterized among this community and availability of migrant health workers that can ease language and cultural barriers. The efforts of local government, health sector, and religious sector, private and public organizations will be utilized to also include people at risk like newly arrived migrants, undocumented immigrants, as well as the elderly. This is the end of the presentation, and thank you very much for listening. And this is Dennis Redubla, and have a nice day, everyone.